All right, I have noon on my computer now. I think I'll give everyone maybe another minute to see if there's any others that'll join, and then I'll start. All right, everyone. Good afternoon, or I guess morning, depending on kind of where you currently are. My name's Will Whitehouse. I am one of the ACVNU residents, and I'm at Purdue, as you can probably tell from the PowerPoint. Today's journal club article is going to be on usefulness of serum amyloid A for the diagnosis of pyelonephritis in cats, a prospective evaluation, which is a kind of recent publication in JVIM. And I picked this article because kind of having kind of further evidence to try to make a diagnosis of pyelonephritis, I think can be helpful from a therapy or antimicrobial stewardship kind of standpoint. But also kind of one of the residents here at Purdue and I are doing a project kind of in the same vein, kind of in dogs. So for an outline for today's presentation, we'll kind of do a traditional kind of section by section for a manuscript. So we'll talk a little bit about the background, pyelonephritis in cats, acute phase proteins, kind of in their use primarily in human medicine as it relates to kind of this disease and kind of what we know about serum amyloid A. We'll go through the studies, kind of objectives and hypotheses and study design, then delve through kind of the results, discuss those results, kind of go through limitations of the project, and then kind of what the ultimate conclusion of the authors kind of is. So for background, we know that pyelonephritis occurs in dogs and cats, and in cats, it is an important cause of acute on chronic kind of kidney disease. However, there seems to be kind of an overall kind of low prevalence kind of it. So in Hilla Chen's kind of case series from Correct, I think they had 8 cases, which ended up being about 8%. In their population, which was kind of taken over, I think it was a 3-year time period. And the recent case series that we kind of published from cases from my time at Kansas, as well as from cases at the University of Wisconsin, we found 32 cases over a 7-year period that had a presumptive kind of diagnosis of acute pyelonephritis. And kind of we did that by looking at kind of positive urine cultures, which between those two universities in that time period from cats, there were about 2,600, kind of looking at the positives and kind of figuring out which cases had pyelo and which ones probably kind of didn't. The authors also kind of discuss how pilocentesis is typically regarded as what's needed for a definitive diagnosis. And we know that there's kind of evidence kind of as far as its usefulness for making the diagnosis with support and evidence kind of against kind of how helpful it can be. But we know that it is something that is relatively kind of invasive, though has a overall kind of relatively low complication kind of standpoint from a major complication time frame or thought. And just due to a variety of factors, isn't routinely kind of performed in kind of clinical practice, whether that's due to kind of what the clinical question trying to be answered is, kind of, or comfort of the radiologist, or kind of what's just routinely kind of done at an individual institution. So all of that basically meaning kind of it ends up being oftentimes a presumptive diagnosis for kind of most cases. With regards to acute phase proteins, kind of we know that these are proteins that are found in blood. For the most part, they are synthesized kind of by the liver, kind of in response to different pro-inflammatory cytokines, particularly kind of IL-1 and 6 and tumor necrosis factor kind of alpha. But other tissues are able to synthesize these kind of proteins as well too. And typically this is going to kind of be from activation.
They just pop it regularly. So I choose to go with, it's just one of those like regularly scheduled popping.
I think someone might have their, if they're not on mute. So if you're able to do that, that would be helpful. Thanks. So again, from activation of the innate immune system, kind of after exposure to non-infectious and infectious kind of inflammatory kind of diseases, as well as potentially kind of trauma. So these cytokines primarily come from macrophages and neutrophils, and typically kind of they are seen more so kind of with systemic, but also can occur with just local kind of inflammatory diseases. We know acute phase proteins can be kind of both positive kind of or negative, with albumin kind of being one of the more common kind of negative acute phase proteins. And they're typically classified as either major, moderate, or kind of minor, kind of with regards to kind of response to inflammation. And so typically these proteins should be very low concentrations kind of in healthy kind of states. And then kind of after some sort of insult, major acute phase proteins will increase quite dramatically in a short time frame, and typically that's going to be within kind of 1 or 2 days. And they also kind of decline rapidly kind of during the recovery phase. And then moderate and minor kind of acute phase proteins typically don't have as much of a kind of robust response and might not correlate kind of quite as well kind of with both the insult as well as recovery. Serum amyloid A, as everyone is probably very aware of, is the major acute phase protein kind of in cats. And again, kind of in low circulating concentrations kind of in health. It is a heterogeneous protein that makes up part of the high density lipoprotein complex. And as I had mentioned kind of on the previous slide, is primarily synthesized kind of by the liver. But there are kind of different isoforms that may be produced in extrahepatic kind of tissues, kind of such as the jejunum and potentially kidney and kind of macrophages, as well as other places kind of depending on species. It has primarily pro-inflammatory, but also some anti-inflammatory, and I guess some non-inflammatory kind of effects as well too, and is found to interact kind of with kind of multiple different types of receptors. So it has some action kind of in the transport of cholesterol kind of in the liver for secretion kind of into bile. It has affinity for different kind of toll-like receptors, as well as the receptor for advanced glycation of end products for kind of further cytokine production and activation of NF-kappa B. And also kind of plays kind of some role in both migration or recruitment of inflammatory cells kind of to sites of inflammation, but also the opposite. And in some situations kind of might inhibit chemotaxis. And also kind of opsonizes bacteria kind of for phagocytosis. In human medicine, particularly kind of with urinary kind of tract infections, acute phase proteins, particularly C-reactive protein and procalcitonin have been the primary ones that have been kind of looked at. And everyone's probably aware of C-reactive protein. Procalcitonin is essentially a precursor to calcitonin, and different cytokines and kind of particularly endotoxin kind of actually inhibit the final steps of calcitonin synthesis. So that can lead to an increase in procalcitonin concentrations. But essentially kind of the rationale kind of behind using kind of acute phase proteins, particularly to try to distinguish between bacterial infections and I mean severe bacterial infections kind of from other disease processes is because typically severe bacterial infections are associated kind of with a cytokine in a store. So just referencing kind of a few studies, and all of these studies again, kind of are primarily looking at CRP kind of and or kind of procalcitonin. So the populations are kind of different. The cutoffs are different as well. But essentially, they have been shown to be helpful in differentiating between kind of bacterial infections and viral infections. Between bacterial infections from critical patients in ICU that have fevers that are due to a non-bacterial kind of illness, from cases that have pyelonephritis kind of versus just bacterial cystitis, from acute pyelonephritis from just renal infarction, and then from patients who have obstructive urolithiasis, kind of particularly or specifically urethralis, and those obstructive cases with and without kind of pyelonephritis. Also, kind of with regards to pyelonephritis, it does seem to kind of respond kind of nicely with recovery and kind of those cases where there might not be kind of as much of a decrease or a persistent kind of increase in these acute phase proteins, kind of those populations tend to have either are more likely to kind of relapse or not respond to treatment kind of effectively. So some of the kind of themes from kind of some of these papers, though, are that kind of actually looking at kind of one isolated kind of value of an acute phase protein, kind of either C-reactive protein kind of specifically kind of might not be as helpful. Procalcitonin actually tends to be a little bit better of a predictor than CRP, kind of, but also kind of looking at kind of the kinetics or kind of velocity kind of might be more helpful than just an isolated kind of value as well too. So that can be done a couple of different ways, kind of one being kind of looking at the initial kind of C-reactive protein value kind of in relation to when kind of clinical signs start, or looking at CRPs kind of over kind of a multiple day period, usually like the first and second day. So that brings us to kind of the study objectives kind of for today's papers. And so the authors here kind of wanted to report and compare the clinical, biological, and diagnostic imaging findings in a cohort of cats with either suspected or confirmed kind of bacterial pyelonephritis, as well as to evaluate the accuracy of serum amyloid A concentration as a marker of pyelo kind of in cats. And their kind of hypotheses were that cats with bacterial pyelonephritis would have higher serum amyloid A concentrations compared to cats without pyelo, but had other different kind of urinary tract diseases. Also, they thought that cats with bacterial pyelonephritis kind of would have more frequent biochemical or ultrasonographic changes indicative of renal inflammation. So for their study design, this is a prospective kind of case control study, kind of though parts of this kind of actually read more like a retrospective study, kind of which I'll point out, but it's prospective in nature, and the time frame for recruitment kind of was between December 2018 and 2022. And their inclusion criteria, kind of, they say they were recruiting adult cats, but they had to be at least kind of 6 months of age to qualify for this study. They needed to have clinical or biological findings of either kind of upper or lower urinary tract disease, and listed a lot of kind of common clinical signs kind of seen with that. They also said that a cat could be included into the study multiple times if they had separate episodes that were at least kind of 3 months apart. And in between kind of the episodes, there needed to be some sort of documentation that whatever they came in for had resolved, and any kind of pertinent abnormalities kind of had resolved as well too. For their exclusion criteria, any kind of overt systemic kind of inflammatory, infectious, or neoplastic diseases kind of warranted exclusion. They also excluded cats with kind of urethral obstructions, and it is kind of reported kind of that serum amyloid A is high in those cases, and in some cases can be kind of quite dramatically high. But we also know that with the other urinary tract diseases, we'd probably expect some increase with serum amyloid A as well. So I don't know, take it or leave it as far as kind of excluding kind of that population. They also excluded cases kind of where serum amyloid A was performed greater than 48 hours kind of after hospitalization, or again, if there were kind of incomplete medical records, which again kind of reads as maybe something that would be done retrospectively. They also stated that they did allow kind of administration of antibiotics, anti-inflammatories, or immunomodulatory kind of drugs that were given prior to kind of referral, which I think ended up actually being okay in the end, since getting a little bit ahead of myself, but they were able to censor data and reanalyze things, and none of the cats actually received any sort of anti-inflammatory or immunomodulatory drug, but that potentially kind of had the kind of possibility of making it really messy. And kind of with their cohorts, they grouped them into two groups and then kind of subgrouped them as well. So group one cats were cats that were determined to either A, have confirmed bacterial pyelonephritis, which they said that a positive urine culture with urine collected via pilocentesis would qualify for them for that. And then B were the suspected or presumptive bacterial pylo cats, which was based on a consensus of 3 internists, and they had to have at least kind of 3 of the 4 kind of following criteria. So the cats needed to be azotemic, kind of which they defined as a serum creatinine above their lab's kind of reference interval. A positive urine culture with urine collected either kind of via cystocentesis or from a subcutaneous urethral bypass device port. Hyperthermia, so body temperature needed to be 39.5 degrees Celsius, and Fahrenheit would be 103.1, or renal pelvic dilation, kind of at least 1 millimeter. And then kind of group 2 cats were cats that had bacterial pyelonephritis excluded, and that was with a negative kind of urine culture collected via pilocentesis. Or pyelonephritis was deemed unlikely, kind of based on they didn't meet the following kind of criteria kind of that I just had mentioned. Kind of other methods. Their renal pelvis measurements were performed by just one of the investigators, which I think I am interpreting this part as being kind of retrospective, which is fine and could be helpful from keeping things standardized or consistent. All urine had to be collected either by cystocentesis, pilocentesis, or from a subport. All of the cats kind of had a standard urinalysis and urine culture, and their antimicrobial susceptibility testing kind of was used using the Kirby-Bauer just diffusion kind of method. And then at least kind of serum creatinine and blood urea nitrogen kind of needed to be measured. And they said kind of basically other kind of lab work was up to the discretion of the attending clinician. So obviously these are kind of helpful and necessary parameters to have from a prospective study kind of standpoint. Things could be a little bit more kind of uniform and complete, kind of if they had done more. But obviously kind of finances and budget kind of might play a role in kind of what could be done kind of for each of the cats. And then serum amyloid A was performed kind of within 48 hours kind of a presentation. Samples didn't go through a freeze thaw cycle, and they used an assay that was validated in cats. It was a latex agglutination turbidimetric immunoassay, and for those kind of doing studies on SAA in cats kind of in the States, kind of a lot of times, or a lot of the ones I've seen kind of are sent to the University of Miami in their acute phase protein lab, and the methodology is essentially kind of the same. For their kind of data analysis, they did do a sample size calculation, and they didn't really reference kind of how they determined the proportion of cats that would have an increase, or they thought would have an increase kind of with serum amyloid A with pyelonephritis, or other urinary disease kind of groups, as well as kind of the cutoff. So I wasn't exactly sure kind of how they came up with those numbers, but sample size calculations are an estimate, and they had one, and kind of based on that, needed 12 cats kind of in each group. Their continuous variables, they reported as median and interquartile range, and used non-parametric tests, probably most likely because of expected kind of low numbers in groups. For their categorical variables, they either, when looking at kind of comparing proportions, used either chi-squared or Fisher's exact testing. They used a linear mixed model to assess the association between having a sub-device and serum amyloid A. And they calculated sensitivity, specificity, positive and negative predictive values, and statistical significance was set at a p of less than 0.05. So I guess before moving into results, does anyone have any comments about the study design or kind of anything else thus far? Okay. So one of the things that I liked about the study was I thought that their figures and tables kind of really depicted kind of all of their results kind of pretty nicely. And so you basically could just kind of look at those and not have to read too much of the text. So this is figure 1, which is a flow chart, kind of looking at their cohort and kind of which cases were excluded in their final numbers kind of at the end. And so initially 250 observations. Again, cats could be included kind of multiple times. 24 were excluded kind of because of urethral obstructions, 42 because some sort of concurrent disease was found on diagnostic workup. 7 were excluded because there was a delay in measurement of serum amyloid A. And then 28 were excluded because of incomplete medical files. So some of those, again, are a little bit more reminiscent of kind of what would happen with a retrospective study, but apparently this is prospective. So their final numbers, they had 149 cats, and you can kind of see the division of those cats kind of in group 1 kind of versus group 2. And in group 1A, they have 8 cats. In group 1B, they had 9 cats. I think there is a little bit of a typo kind of in these. So group 2A, kind of on all of the other tables, I think they had 19 cats, and then 2B, 113. This table kind of looks at the clinical signs kind of between the groups. And so we have lots of different clinical signs, groups kind of 1A, 1B, 2A, and 2B kind of at the top. And kind of as you can just kind of see, systemic kind of non-specific kind of signs were the predominant kind of things that were found. Very kind of few cases, at least in the pyelo group, kind of had lower urinary tract kind of clinical signs. What I thought was kind of most kind of interesting, though, was the duration of clinical signs. And it was kind of found to be significant kind of between the two groups, but the median kind of for group one overall was 48 days, and for group two kind of was 168 days, which obviously kind of chronic diseases are um, included kind of inherently kind of with group two, since they were looking at a variety of urinary tract diseases. From a pyelonephritis kind of standpoint, I typically think of that as something that we see kind of more acutely. Obviously, it can be a chronic condition as well too, but just the high number or the um, high median kind of I just found surprising in their population. This table kind of looked at their method of urine collection, as well as kind of what organisms grew. So those taken directly from kind of the renal pelvis, not surprisingly, E. coli grew kind of in most of those cases, as well as from the suspected kind of pyelo cases as well too, but there was a smattering kind of others. And um, cases kind of in the group 2B group kind of were a bit heterogeneous kind of as well. This table was kind of split up into kind of two sections, and essentially reported some kind of patient demographics as well as some of the selected kind of CBC, serum biochemistry and ultrasound kind of findings kind of between the two groups. Again, kind of diagnostic workup kind of wasn't standardized, and they had reported kind of that CBCs were performed in only kind of 46% of the cats, and then full chemistries were performed in 30 kind of percent of the cats. Here are their kind of renal values, and since I'm kind of narrow-minded and used to what I'm used to, kind of with regards to kind of units, I put in kind of what those things kind of would be, both kind of Fahrenheit for rectal temperature as well as milligrams per deciliter for urea and creatinine. And from those values kind of that they did data analysis on, essentially kind of group one as a whole compared to group two as a whole, didn't find any significant difference kind of between hemoglobin, kind of white blood cells, total neutrophils count, as well as some ultrasound findings. And so was there echogenicity kind of around the kidneys, or pelvic or renal hyperechogenicity, or some other kind of clinical pathological values as well, which
I have one of
is
the empty containers right above you. Yeah. Thank you so much.
not surprising, kind of given how heterogeneous, again, kind of group 2B was, but would also make it a little bit hard to know kind of how clinically helpful any significant findings kind of would be. This figure was basically looking at or reporting serum amyloid A concentrations between each of the different subgroups. And there's obviously kind of some overlap kind of with the group B patients, but serum amyloid A was kind of pretty profoundly kind of increased in the confirmed and suspected pyelonephritis cases compared to kind of those cases where pyelonephritis was excluded kind of or deemed to be kind of less likely. And serum amyloid A concentrations were found to be kind of significantly higher in the 1A kind of cats compared to the 2A as well as 2B. And then same for group 1B cats where SAA was significantly higher kind of compared to the 2A cats kind of in 2B cats. Looking at kind of proportion of cats that had a serum amyloid A above kind of the reference interval, all of them in the confirmed and kind of suspected pyelonephritis groups had high serum amyloid A concentrations, whereas none in the group 2A, and then 20 in the group 2B did. And here are the serum amyloid A kind of concentrations, as well as what the non-pylo cats kind of were diagnosed with. And so those cats that had pyelocentesis, but cultures were negative, obviously kind of they were primarily looking for ureteral obstruction kind of in these cats. I kind of wish that there were kind of more AKI cats, but only kind of one where they had AKI of unknown origin. And serum amyloid A kind of was a lot lower than the pylo kind of groups, but it's hard to interpret the significance or meaning kind of from an N of 1. And then here are the serum amyloid A kind of concentrations with all of the other kind of diseases kind of that were diagnosed. And of what I found kind of most surprising kind of was that those cats with cystitis kind of from stones had the highest serum amyloid A concentration, at least kind of median. That's just not something I was expecting to see compared to kind of what other groups kind of were included in the this population. This is the ROC kind of curve, which is drawn by plotting kind of the true positive rates against the false positive rates kind of at every threshold. And then the area under the curve basically sums up kind of how well the model kind of discriminates between the positive and the negative instances. And figure 3 kind of A kind of looks at the entire kind of population, and figure 3B kind of looks at those cases kind of where cats who had received antimicrobials, which I think were 9 of them, those who that had received antimicrobials before presentation were censored. And the optimal kind of cutoff for kind of the entire kind of population with regards to sensitivity and specificity kind of for SAA was 51.3 milligrams per liter, and sensitivity was 88% and specificity was 94%. When those cats receiving kind of antimicrobials beforehand were excluded, the optimal cutoff was determined to be 25 milligrams per liter with a sensitivity of 100 and a specificity of 94. And the area under the curve were pretty good and high. This last table just reports the kind of positive and negative predictive values. And so sensitivity and specificity are essentially kind of telling us the probability of either a positive or negative kind of test result given the presence or absence of disease, kind of respectively. Whereas positive predictive value is the probability of the presence of disease kind of given a positive test result. And then the negative predictive value is the probability of the absence of disease kind of given a negative test result. And as expected, kind of positive predictive value kind of would be kind of much lower kind of when prevalence or frequency of disease is lower. In kind of Hilla's paper, at least looking at acute on chronic kind of cases, it'd probably be close to 10%. But thinking about what it probably is kind of in the entire kind of clinical population, kind of probably kind of much or closer to 5 or even kind of lower than that. And so these are essentially kind of the different hypothetical pretest probabilities kind of that they had kind of come up with. And at 5%, positive predictive value kind of was 44%. So essentially that's saying 44% of cats kind of with an increased SAA or serum amyloid A kind of have pyelonephritis, which is a little bit worse than a coin flip. But negative predictive value is pretty high. So 99% of cats with a normal serum amyloid A kind of would not have pyelonephritis.
And I was happy to see this figure, this table in the document, because I think it really changes how you interpret their data, especially looking at their ROC curves, which are nearly perfect. We don't really have a good assessment of how frequently we see pyelonephritis, but from Hilla's paper, as you were suggesting, it's pretty low. The canine necropsy paper, also pretty low number of patients from multiple centers over a long history of time. So it could be that the disease is hard for us to diagnose. It could be that maybe pyelo doesn't happen nearly as often as we think it does. But if you just look at acute kidney injury, period, in cats, looking at how frequently it's going to be due to pyelonephritis, I think we're still left not really knowing how frequently it occurs, and some of that's going to be due to the limited ability to have confidence in that diagnosis. Most of those cats we're probably not going to do pyelocentesis on unless we might be doing a pyelogram. We're probably not going to just want to confirm that we have pyelonephritis and put them through that, especially if we have bacteriuria from a bladder sample too. So we really don't know even where to begin here. We have very little data on what the frequency of pyelo is, and even with that, we have to look at different populations. AKI, acute on chronic, so different patient populations probably have different frequencies. So it was nice to see this, and I think it really underscores its ability as a diagnostic test to confirm it, but maybe gives you more comfort in using it as an exclusatory test to maybe take it off your differential list.
Yeah, I agree with all of that. And if JD, I think it like considering the influence on disease prevalence, I think really kind of helps underscore kind of the overall utility kind of the diagnosis or diagnostic test and the results that you get. So that brings us to the discussion. So ultimately, they said they found that serum amyloid A can be a useful tool to distinguish bacterial pyelonephritis from other urinary diseases in cats. And it had relatively good sensitivity depending again to some degree on prior therapy. So whether or not they received antimicrobials, which I don't know about kind of what your hospital kind of sees. A lot of the ones that do come here get antibiotics kind of as they're kind of leaving the door on the way here. So hard to know what that could do to serum amyloid A kind of concentrations. It does seem to be less specific. And one of the things that I think kind of could be interesting to look at would be kind of not only kind of following these patients and seeing kind of how serum amyloid A kind of looks as far as response to treatment, but kind of going back to kind of what one of their kind of goals was to look at, is this something that could potentially be helpful for from an antimicrobial stewardship standpoint, and could it help guide kind of a appropriate antimicrobial therapy kind of for these cases. And so I was essentially kind of taught or trained that essentially all acute kidney injury patients kind of should be put on antimicrobials empirically, and to try to de-escalate kind of when you get a negative culture kind of back. But I think that we are learning that pyelonephritis is not as prevalent kind of as we once kind of thought, kind of as JD had mentioned. And so there are probably kind of lots of cases where antibiotics are probably kind of not helpful or even wrong to do. The authors kind of also discuss how diagnosis of pyelonephritis kind of can be very challenging, and that there is a need for some reliable, easy, non-invasive diagnostic to aid in making kind of that diagnosis. And there just kind of lists a couple of the things that were brought up. So we can obviously see kind of acute kind of versus chronic disease in cats. It seemed like they had at least some chronic pyelo cases in their cohort. And so I guess one can infer that serum amyloid A is going to kind of be high in both acute and chronic kind of cases. Fever is going to be kind of variably kind of present in the population. They reported that it was about, I think, 40% of cats in this group. In the kind of retrospective kind of that we had just kind of published, it was kind of much, much lower than that. Azotemia, obviously, kind of most of our cases are going to be azotemic. They did have one cat that had a positive culture collected via pilocentesis that was positive, and that cat was non-azotemic. They had mentioned kind of subclinical bacteriuria. So obviously, kind of we can see kind of this in both CKD and kind of non-CKD patients. And so it is something that I think we're catching more commonly, and can be kind of a confounding factor when we get a positive kind of culture from the urinary bladder, and trying to decide kind of what to do, and could there be renal involvement if it's a CKD patient who's already azotemic. And then kind of as mentioned kind of previously, kind of differences in cystocentesis kind of versus pyelocentesis, and kind of utility of of doing those for kind of looking for infection. And obviously kind of there's like evidence kind of for and against kind of usefulness kind of that kind of at least based on a couple of retrospective case series. I don't know if ultrasound warrants kind of that much discussion. It seems to be non-specific. In this population, they did have a pretty kind of high percentage. It was just over 50% of cats that had kind of urolithiasis. And so they discussed the possibility of stones potentially being a risk factor for pyelonephritis. In the retrospective kind of we did, I meant to look this up and forgot. I don't think we had a lot of cats from what I recall though that had concurrent kind of urolithiasis. And so it's kind of hard to know if that kind of plays a role kind of in development of disease or not. And then in this study, they didn't find an association with having a subdevice in serum amyloid A, but obviously we can find things like hematuria and pyuria kind of on our kind of urine sediments, kind of when we collect urine kind of from subdevices. So it's probably causing some mucosal inflammation in some instances, and so it's hard to know if truly there is kind of any influence on acute phase proteins kind of with cats that have subs, especially those that are in kind of long term. Their limitations, they had a few. None of them, I think, necessarily kind of nullify kind of any of their findings. But obviously the populations, particularly since they included kind of all cats with various types of urinary tract diseases, was fairly heterogeneous. Some cats obviously did receive antimicrobial kind of therapy kind of beforehand. And so in clinical practice, it might be kind of a little bit more difficult to know kind of what to do with those cats and how to interpret serum amyloid A if they had been started kind of beforehand. Timing of serum amyloid A measurement was not necessarily uniform in relation to the onset of inflammation. So we know that acute phase proteins kind of spike kind of pretty quickly. In chronic kind of disease states, it's a little unknown kind of what they will do after that. They will probably stay high, but do they decrease significantly? Kind of hard to know. And again, there was a significant difference in development of clinical signs and time to presentation between the two groups. And so could that potentially have kind of introduced some bias? And then, as mentioned kind of previously, diagnostic evaluation was not standardized. So overall conclusions kind of are that serum amyloid A in cats kind of with bacterial pyelonephritis is higher in cats than those cats with other urinary diseases. And their optimal threshold kind of taken from their entire population was serum amyloid A concentration of 51.3 milligrams per liter. And it seems to be sensitive, but it is not necessarily as specific. So as GD had said, kind of seeing a low or normal serum amyloid A would probably be kind of the most helpful scenario in order to try to rule out a case that has pyelonephritis. But how often would we be in that situation compared to getting a high value and not knowing what to do with it? Hard to know. So any other kind of thoughts, questions about the paper?
I thought it was a good attempt, but I'm still left with feeling unsure about the categorization of where cats fall. And I think that there's just no way that we can be absolutely sure which cats have pyelonephritis and which ones don't, because it will probably just require us to be very invasive for our patients and doing pilocentesis or kidney aspirates for culture, or maybe even a biopsy for culture to get definitive information. And that just seems a bit extreme for most of our patients. So I don't really know how to deal with that. Having these non-invasive biomarkers or less invasive biomarkers are helpful, but I think with each of these studies, if we still have questions upon the enrolled categories of cats, then we essentially either need multiple studies to be done on different patient populations to really refine the cutoff more, or maybe a panel of several different things to be able to look at. Like maybe some cats might have a high amyloid but a normal CISB, and maybe that pattern is associated with a slightly different underlying disease process than those where they're both elevated, or the flip-flop could be occurring. But that's probably the best way we can gain additional insight with all the limitations, is just to try to compile them and get a bigger panel that might give us, you need to have 3 out of the 5 biomarkers be abnormal, and that's associated with the highest confidence in the disease, especially for a disease that might have a very low frequency of occurring, where you're really trying to find those tests that are going to be highly specific and not be just a general acute phase protein that might have a bunch of other reasons to increase. So I thought it was a good study, but I'm still left with not 100% being convinced of cats are enrolled and placed in the correct groups that they should belong in.
Yeah, I think all of that is fair. I think that it probably has some utility, but it's not necessarily better than, like you said, some of the kind of active injury biomarkers, kind of, or potentially even just looking at your kind of urine sediment. I mean, there's evidence that kind of bacteriuria, to a lesser degree pyuria, is going to be kind of predictive of culture results as well. So, but I agree that kind of currently we're left with kind of looking at a holistic approach to kind of making the diagnosis kind of currently. Anyone else? Oh, yes.
Hello. Thank you for the nice presentation. And sorry, I might have missed this because I was trying to multitask initially, which is never good and means I wasn't fully paying attention. But you referenced saying that urethral obstruction was also a cause of elevated serum amyloid A, or referred to that, which is something that I had passed me by, and I was interested about that, and in reference to what JD was saying about just not being entirely comfortable with the confirmed diagnosis of pyelonephritis. I mean, I just wanted, because they did seem to have, well, quite a lot of patients with pyelonephritis over a relatively short time, and then lots of them had stones and lots of them had urethral dilation. So I guess it just made me concerned that there might be more cats that were obstructed but didn't truly have pyelonephritis. Now I know the ones that had pyelocentesis and were culture positive, I mean, that should have been some evidence in support of it, but I don't know. I mean, it all depends because they had a cutoff of 10 to the 3, which I think is quite standard for papers. But by the same time, most of the cultures that you get back from the lab are greater than 10 to the 5. And anyway, sorry, that's a big, long digression. But do we have an understanding of why serum amyloid A goes up in obstruction?
So I know it's high, I guess, as far as the kind of pathophysiology goes. I have to kind of reread that paper. I'm presuming kind of it's potentially related to maybe cystitis kind of that develops, but I don't know if we know definitively kind of why it's high kind of in that group. From what I recall, kind of the median or mean kind of were still kind of relatively low, but I think they did have a handful of kind of outliers where serum amyloid A kind of did kind of get quite high kind of in those urethral obstruction kind of cases, but I don't remember how much excluding kind of they did of concurrent disease as well.
Right. Yeah. Thank you.
All right, anyone else?
Thanks, Will. Really appreciate it.
Yeah, thank you all for joining. All right, have a good afternoon.
Thank you.